Hey there, Revenue Cycle rock stars. Welcome back to the Revenue Cycle Decoded podcast. I'm your host, Gina Cornett, and we are talking about all things revenue cycle. Today, we're going to dive into Qualified Medicare Beneficiary, or QMB, one of the most honestly compliance risk-heavy programs in healthcare billing. If you've ever had a patient tell you, I have Medicare and Medicaid, so I don't owe anything, you've probably encountered the QMB program. And if you've ever wondered what that actually means for your billing process, what you can and can't charge, and how to avoid compliance violations, then this episode is for you. Today, we're going to cover everything that you need to know about the QMB program, including who qualifies, how the program works, common billing mistakes, compliance risks, and questions that providers and practices ask the most. Before we jump in, take a second to hit that like button, subscribe, and share this video. Now, let's get into it. First of all, what is the QMB program? The Qualified Medicare Beneficiary Program is a Medicaid benefit that helps low-income Medicare beneficiaries by covering their Medicare premiums, deductible, and coinsurance costs. It is meant to protect low-income Medicare beneficiaries from out-of-pocket costs, but it does come with a long list of billing rules that providers absolutely must follow or risk violating federal regulations. So here's what that means for providers. If a patient is enrolled in QMB, they cannot be billed for Medicare-covered services, including copays, coinsurance, and deductibles. Even if Medicaid doesn't pay the full balance after Medicare, the provider must accept it as payment in full. And federal law prohibits balance billing QMB patients, even if you aren't enrolled as a Medicaid provider. This program exists to protect low-income seniors and disabled individuals from healthcare costs that they can't afford. And that means healthcare providers have to be extremely careful about how they handle billing these patients. Who qualifies for QMB? Patients don't enroll in QMB the way they would sign up for a regular health plan. Instead, QMB is a Medicaid-administered program for Medicare beneficiaries who meet strict income and asset requirements. To qualify, a patient must be enrolled in Medicare Part A and/or Part B and have income at or below the federal poverty levels, and those limits do change annually. They also have to have limited assets, including savings, investments, and property. Patients who qualify for QMB are often referred to as dual eligible beneficiaries because they have both Medicare and Medicaid. It's important to note that QMB is not the same as full Medicaid coverage. A patient with QMB only has Medicaid for helping with Medicare cost sharing. Some QMB patients may also qualify for full Medicaid benefits, but not all do. Recognizing which of your patients are enrolled in the QMB program is crucial to ensure compliance. Patients may present both their Medicare and Medicaid or QMB cards at the time of service. Since QMB patients often have both Medicare and Medicaid, it's easy to assume they're like any other dual eligible beneficiary. But the difference is that QMB patients are federally protected from being charged for Medicare cost sharing. The best way to confirm QMB status is by running an eligibility verification check before the patient's appointment. Medicare Administrative Contractors, or MACs, provide online eligibility tools, and most state Medicaid websites also offer eligibility verification portals. In many cases, a provider's electronic health record or practice management system will flag QMB status during insurance verification. But if your system doesn't do this automatically, be sure to manually check for eligibility. Additionally, Medicare remittance advice forms often include a QMB indicator, reminding providers that the patient cannot be balance billed for Medicare-covered services. If you see this indicator, it's crucial to adjust the patient's account accordingly before sending out any statements. One of the most frequent mistakes providers make is billing QMB patients for their Medicare deductibles or coinsurance. This happens because sometimes Medicaid pays little or nothing towards the patient's remaining balance, and many billing departments assume that if Medicaid doesn't cover the full amount, the patient is responsible for the difference. However, federal law states that QMB patients cannot be charged for Medicare cost sharing even if Medicaid does not make an additional payment. Another mistake is asking QMB patients to pay at the time of service and then refunding them later. Even if the intent is to return the payment once Medicaid processes the claim, this is still considered improper billing. Another area where mistakes occur is with non-covered services. If a service is not covered by Medicare, a QMB patient can be billed, but only if the provider obtained an advanced beneficiary notice or ABN before rendering the service. Without a properly executed ABN, the provider is required to write off the charges even if Medicare denies the claim. The Centers for Medicare and Medicaid Services, or CMS, takes QMB billing violations seriously. Providers who improperly bill QMB patients can face audits, corrective action plans, and even Medicaid enrollment sanctions. Beyond the regulatory risks, billing QMB patients incorrectly can create a financial burden for individuals who may not realize they don't owe anything. To avoid compliance violations, providers should train staff on QMB rules and make sure billing and collections teams understand that QMB patients cannot be charged for Medicare cost sharing. Implementing safeguards in your billing system, such as automated claim edits or account flags for QMB patients, can prevent improper billing. Staying up to date with federal and state Medicaid regulations is also important because policies can change. A common question is, what if I am not a Medicaid provider? Do I still have to follow QMB billing rules? The answer is yes. Even if you don't participate in Medicaid, you still cannot charge QMB patients for Medicare cost sharing. If Medicaid doesn't reimburse you because you're not an enrolled provider, you have to write off the balance rather than billing the patient. Another frequent question is, can a QMB patient ever be billed? The only time a QMB patient can be held responsible for a charge is if Medicare denies the claim as a non-covered service and the patient signed an ABN before receiving the service. Without that valid ABN in place, the provider has to absorb the cost. Many providers also ask, what if Medicaid pays nothing towards the balance? If Medicaid does not make a payment after Medicare processes the claim, the provider still cannot bill the QMB patient. The amount Medicaid does not pay must be written off, and the patient cannot be held responsible for the remaining balance. Understanding the rules around QMB is just one piece of the puzzle when it comes to healthcare insurance. If you're looking to strengthen your knowledge around how Medicare, Medicaid, and commercial insurance work, and how to bill correctly for all types of payers, check out my Introduction to Healthcare Insurance course. This course will walk you through the fundamentals of healthcare insurance, key terminology, and the most important rules that revenue cycle professionals need to know. If you're serious about improving your understanding of payer policies and reimbursement, this course is for you. Go to revenuecycledecoded.com to enroll today. Thank you so much for listening to this episode. If you would, please take a second to hit that like button, subscribe, and share this video. Staying compliant with programs like QMB isn't just about avoiding penalties. It's about protecting your patients from unlawful billing and keeping your practice compliant. And before you go, let me know in the comments, what's been your biggest challenge with QMB billing? Let's talk about it. I'll see you in the next episode. Peace out.